to the HRB breakfast page, and of course to Sunday Best page. And I know Dr. Seshley will be sharing that as well. How are you doing this morning? Did you have a good weekend?
Oh, it was amazing, Apoko. Absolutely amazing. I had
Mm.
such, we had birthday celebrations from Thursday or Wednesday night until yesterday evening. So we've just been
Mm.
celebrating all the birthdays, and it's been absolutely amazing, I must say. We had amazing weather. So we had barbecue for the last 4 days. So from
No
Thursday,
way.
Friday, Saturday, Sunday, yes. I'm serious. I think I'm an expert now at making a barbecue. I honestly.
Well, I know that, but I was thinking, you beat me to it. I thought I was going to beat you to it,
What
but you
about
have me.
making barbecues?
Yeah, I thought I'm going to start making, having a barbecue
Oh, you
anytime
need
soon.
to. And
But you,
the way we've
no, don't worry
spiced
about
it.
it. It's okay to beat me to it.
And I think you always say, marinate your meat beforehand quite long. And it does
Absolutely,
make a difference because the
it does.
days that I just marinated it on the spot compared to the days I marinated the meat beforehand or chicken or
Hmm.
whatever it was so different. So, yeah, we'll have to
Yeah,
have a show talking about barbecues and about
yeah,
spices.
and give tips on the barbecuing and marinating meat and
Yes.
fish and all that. That will be good.
And I mean, the sun's out today. I'm so tempted. You just put the bri
It's
on every
absolutely
day.
beautiful out there.
It
It's
is.
absolutely beautiful. I'm just looking through my conservatory, the window, and
Yeah,
it's absolutely gorgeous.
it is.
I'll have to start trimming the garden, just doing some stuff in the garden from probably next week or so. I don't know.
Yeah.
I'm a bit too lazy now.
Thank you
Anyway,
so much for this beautiful mug. I've got my coffee in this mug.
yeah, you deserve it. Well, I was
Thanks.
sort of, so yeah, I mean, for there's no way we can pay you for the service that you do to the community, but we thought that this gesture it will be just nice for you to have one of our beautiful HRB cups or
Mm,
mugs to have your coffee, since you love your coffee.
I do. I
So
do love my coffee. Thank you.
yeah, so this is coming from myself and Jeff White and all of us here at Hospital Radio Bedford, and thank you very much. And that's your birthday present, you see, from HRB.
Thank you. Thank you so much for the lovely
it,
gift. I
it,
love
uh,
it. I love it. I had
it's
coffee in it
beautiful.
right away yesterday when I received it. Thank you for your niece delivering it. Thank you.
No problems at all. No problem. I've got to go back to the hospital today to deliver more cups, more mugs
Okay.
to the amazing Bedford Hospital staff. The stuff they do, we cannot pay them at all, but we're thinking that they deserve
Yeah.
some HRB mugs. I sent a dozen the other day and handed them over to different workers, nurses, doctors, sub workers of the hospital, and to the departments, to be honest. And we're thinking, well, we need to send some
Yeah.
more. So I spoke to my promotions manager, and yeah, we are. So I've got it in the car. I just have to go to the hospital later on today.
Amazing. I'm
And
sure I love drinking and it's absolutely beautiful. It looks so
thank you.
nice. I think everyone at home wants one now.
Yeah. I'm sure if you want one, you can contact us, and we'll try and get you one.
Good.
As you're listening to us right now, or probably watching us on Facebook, if you want one of the mugs, all you have to do is just go on our website, send us an email at studio@hospitalradiobedford.org.uk. Studio
Okay.
at hospitalradiobedford.org.uk, and I will our promotions manager, Andy Norbury, will pick it up, and then we'll try and sort something out. That shouldn't be a huge problem.
Okay. Lovely. We'll
Right.
do that. Thank you so much. And yeah, things are looking so much better on
Absolutely.
really last 24 hours in the UK. We've had 33 new deaths.
See,
Every life matters, but the numbers have been low, and we've had 5,312 new cases. So it's
mm,
definitely looking a lot better.
yeah, it is. There's a bit of thing with the EU now, isn't there?
Yes.
Well, the Prime Minister is expected to speak to his EU counterparts sometime this week over a row. Or there's a row of COVID vaccine supplies, and the EU leaders, they're going to hold a virtual meeting on Thursday, and they're going to be discussing a ban on the Oxford AstraZeneca vaccine exports to the UK. The Prime Minister aims to put the UK's case in one-on-one phone calls before that. So I think the whole thing. I might be wrong, but I think the whole thing is that some of the vaccines are being manufactured in their factories in Europe.
Yes, all over, yeah.
Yeah, and so that's, I don't know what this is all about. Some people are saying it's just a political gimmick.
Yeah. I don't know what it's about, but it's a bit surprising. I mean, I've heard from sources, they went over the weekend to close sources. They went over the weekend for the vaccine and they were only offered the AstraZeneca. They got a sheet of the AstraZeneca information. And there were rows and rows of people that had gone for it. And even if you wanted the Pfizer, you were not given that. You just had to take the AstraZeneca. So UK.
Well, I'll tell you what, I have a confession to make. I had my vaccine on Saturday.
Amazing.
Yeah.
Oh, well done.
Sorry?
Well done.
Yeah, thank you. And I got the AstraZeneca. I just, when I went, they said to me, well, we got the AstraZeneca. Are you all right to take it? I said, yeah, come on.
Yeah.
Go for it. Because I did tell you that I was going to ask advice.
Yes. Yes.
And I did, and I was assured that it's fine, and so I went and I got it.
Yeah.
And I'm fine. I'm absolutely fine. It's just a little pain in the arm. Just take some paracetamol, and that's it.
Yeah.
So I'm admonishing, of course, as we always say here, we do a disclaimer, don't we? I'm not saying that you must get it. I'm just saying that I got it and I'm fine.
Yeah.
And I know people who got it, and they're all right. So if you're not too sure, just ask your GP or your health.
Yeah.
Yeah.
Yeah. Oh, well done. So I'm glad you're feeling well. I mean, as they say, only like 1 in 5 people will experience side effects, so just some pain at the site of the injection or the vaccination, and then other symptoms like muscle aches, body pains, fever, sore throat, runny nose, cough, and other systemic symptoms, tummy upsets. So not everyone will have those side effects, of course. Some people do get more severe side effects of these vaccines, but I think it hasn't been that many as opposed to how many have received the vaccine. So I think that's what the thing with AstraZeneca is, what they're saying, Apoku, is that in terms of what the cases that have been reported is much less than the amount of people that have been given it and have had no adverse reactions. So it's just about monitoring, sort of side effects. And obviously, if you're not feeling well, just let your GP know. But yeah, I'm glad that you've received it and you're feeling well.
Yeah, for me, when I did ask, and I was assured that it's fine, and also I've seen and heard that people have taken it. I know people, even my colleagues here at the hospital, Radio Bedford, so many of them have done it, and they're fine. And then the third thing that went through my mind was, of course, there could be there are side effects of anything and everything that's medicine or medication. And what's the worst that can happen? That's what I was thinking in my head. I was just being optimistic, saying, what's the worst that can happen? It's better to have it, and that probably would help me than not have it at all and catch COVID. So I might as well just have it, So that's me.
Yeah.
And so whoever wants to go get it, if you want to go get it.
Yeah. I think most people are going for the vaccine, and I think they've realized, you have to, and especially if there's going to be another wave, because there might be another. I'm hearing about Ferdinand was talking about another wave, a Spanish variant that might be coming. So there's talk about that. So I think apparently there's another wave of the virus. It can be quite concerning, and that I think that's another reason why they are urging people to get the vaccine. To be honest, Ferdinand went on Saturday as well, and he had his, and it was also the AstraZeneca.
Yeah.
So
Yeah,
when
well
you
done,
said,
Ferdinand.
yeah,
Well
when
done,
you
Ferdinand. Yeah.
when you said yours, about yours, I wanted you to say yours, and then yeah, so that's what I was referring to. So he went, and there were
Yeah.
rows and rows of people, and yeah, so I mean, you just got a form that you had to. They informed you, and he said there was no, it wasn't obviously there was obviously concerns beforehand, but we had been discussing it a lot, so he knew a lot about
Mm.
it, and he's got friends that have also had it as well, and family,
Yeah.
so he
Yeah.
knew about it, and yeah, so
I
he
tell
had.
you, I tell you what, I tell you what, of course, this is all part of the COVID update, so I'm going to say it. When I went to King's Arms in here in Bedford,
Yes.
that's where I got the jab. The staff, the people from the attendant at the car park where they show you where to park and all that, to the nurse who actually gave me the jab. Absolutely amazing people. Absolutely amazing. Helpful. They talked you through everything. They asked questions. I mean, the nurse, she asked me questions. She asked me, have you had this? Have you taken any medication? Are you this and that? Absolutely amazing. I mean, I have to play a song for these people, and so she and I said to her that I do a COVID update every morning with Dr. Cecily Mudia on Hospital Radio Bedford, and she was so excited. She said, "Oh, that's fantastic!"
Oh my
And I
goodness.
said to her that we talk about vaccination and vaccines and everything, and here I am. And whilst we were having a chat, she put a needle in my arm. I did not feel anything at all. We were just talking, and then the next thing I said, she said, "So that's you done?" I said, "What?" I mean, it's a pity. I was expecting something, like a sharp pain or something. Nothing, absolutely nothing. And these people are amazing. She said to me, "You know what? Did you drive here?" And I said, "Yes." She said, "Okay, well, we would like for you to sit down for about 15 minutes." And then, after 15 minutes, so she gave me the time, 10 minutes past 1. You can go. So I sat down for 20 minutes and then I left. But man, these people are doing a great job, and they need
Oh, well done. They really sound like amazing. I mean, and yeah, and I think they're working at such a speed as well. There's so many people that are getting it, because Ferdinand said there were like rows of people. So even if you got a slot time, there was still like a rows of people that were in front of you. So they didn't even mind if you were late or not. And as you said, the service was really good. They explained everything, and there were some people, he said, that were actually asking a lot of questions about the vaccine, and obviously a lot of concerns. So that obviously people had to tend to them. But he felt fine, as you said. He didn't feel anything, and then he felt fine afterwards, and he was glad that he got it. So yeah, he was quite relieved actually, because he's diabetic. So I think, being a diabetic, he was concerned about obviously COVID-19. That's been our main concern. So and yeah, so it went off well, and he he said, but he was, I think the only sort of maybe concern was that you're not offered the other one, you just offered the AstraZeneca. So even if you do ask for the Pfizer, they're not giving it for some reason. So I'm not sure why that's happening, because some people are getting Pfizer, some are getting the AstraZeneca. I think it seems more healthcare professionals are getting Pfizer, if I'm not mistaken. I'm not sure.
I don't know about that, but when I went, I mean, my experience was, she said to me that we're gonna give you a jab, and it's the AstraZeneca. I did not ask if there was anything else apart from AstraZeneca, and I just said yes, fine. She asked me if you wanted it, if you are you sure you want to get the jab, and I said yes. I mean, I just said yes. And so she said, that's fine. And she gave it to me. So I don't know if I had an alternative, if I had a choice or not. I did not even ask. I mean, my mind was prepped to get it.
Yeah.
And that's what, if she had said, I'm giving you the Pfizer, I would have said yes. If she said, I'm giving Johnson & Johnson, I would have said yes.
Yeah.
Yeah.
So, yeah.
I went with. Yeah. So yeah, I'm kind of glad I got it.
No, I'm glad for you as well. I'm
glad
quite
I
relieved.
got it, and now I can talk with authority.
Yes, and I think in terms of side effects, he was feeling quite tired and some tummy upsets, and yeah, just there's no other side effects. So we're just monitoring Ferdinand's temperature, but he hasn't had anything else. But he has been feeling more tired than usual, and also the tummy upsets, and I don't think there's been any other symptoms. So obviously, it's just about monitoring yourself afterwards. Yeah, no, I'm really glad that you've got it and Ferdinand got it. So it must be a relief for the two of you. So let's see how it goes.
Just a relief for me. So I'm going to get my second job in a few weeks' time. I don't know when. They said they'll contact me. My GP surgery will contact me. So yeah, looking forward to it. Yeah. Right. Okay. Let's move away from the vaccine. We're going to keep talking.
No, and just one more thing, just to say, yes, I mean, like most people have already had it, like you said, even at Hospital Radio Bedford, a lot of people have had it, and there's been no concerns. So obviously, we just need to wait more on what's going on in the news and the world, the debates with the EU, with the WHO, the World Health Organization, Dr. Tedros and his team, and anyone else, just to find out more update on what's going on.
Okay, right. Now, the timetable for ending coronavirus restrictions in England is, and I'm quoting Mark Drakeford, he says it's at the very optimistic end of the spectrum. That's Mark Drakeford, the First Minister of Wales. That's what he's saying. Boris Johnson has actually set out a timetable, we know that, for legal restrictions to be lifted entirely in England by the 21st of June. But Mr. Drakeford is saying that it's highly optimistic. What do you think?
I'm not sure. I mean, I'm not sure. What do you think about it?
I don't know. I think they know what they're doing. The government. I think they're going in the right direction. And and by the way, we can only be optimistic, can't we? We can't just say that pessimism will kill us, really. So I agree with the Prime Minister. I think then again, if nearer the time things are not that great, I'm sure they'll change it. Just like it happened around Christmas when they said we can have different families on Christmas Day and all that, but they changed it when they realized that it wasn't the best option. So I think for me, I think we should just look forward to the 21st of June. And if it's not going to happen, we'll get to know. They'll tell us.
No, I think I agree with Boris Johnson. Things are a lot more optimistic, and according to the roadmap, things have been going really well. I think this is obviously it's a combination of the lockdown together with the rollout of the vaccines, and then the decreased load on the NHS, and the fact that people have understood and taking more precautions. I think everyone's listening, and I don't think I am not seeing anyone. I mean, we haven't really gone out, but when I did go out those days to the center in London, the Sukyo Maikari Center, most people had masks on. I actually didn't see anyone that took a chance without masks. And if we have gone to the shops, Apoku, like I think yesterday morning I went to the shops, I mean, everyone's wearing a mask. Places are actually very quiet. The shops are really, really quiet all over. Whenever I've gone into the shops, it's like maybe just one or two other people, depending on the time I've gone, but it's really, really quiet. So people are listening and they're staying indoors, and they're only going out unless absolutely necessary.
And the other thing I've noticed, I don't know if you have noticed that, honestly, I was expecting that we'll have a little rise at least in the numbers when schools reopen. But it seems as if it's coming down rather. Well, not seems as if it is coming down. Even with the schools, reopened and all that. You remember in September when the schools, in September when they went back to school, then suddenly the first week, boom, it went up. But this time around, it's going down. So we have every right to be optimistic. Because things are they look like they're working out right. they're working okay. And also, you did say with the rollout of the vaccination and the success of it, because a lot of people have been vaccinated, millions of people have been vaccinated, about 40% of the population, I think.
Yeah.
And that's very, very high, and we are the number 3 in the world.
Yeah.
So that's also helped. And on that note, if you tell us what we've got in terms of numbers, that would be nice.
I can't believe the time has just gone and we've just spoken about it.
We just kept talking about it.
No, but it's good. I think it was really good to talk about it. And it's so coincidental that you and Ferdinand had it the same day.
Yeah. I think given the opportunity, we'll just keep on talking about it forever.
I think you must have thought I read your mind because I started talking about the AstraZeneca vaccine.
Anyway. Right.
Oh, Poku. No, I'm glad. So let's move on. So the Worldometer figures as of the last 24 hours. So as of today, the 22nd of March, 2021, it'll be almost a year that we first went into lockdown, the 23rd of March.
That's the 23rd,
So that's tomorrow. So almost a year. So and over a year that we've been doing
this show. Before you go on, sorry. Since you mentioned the 23rd, yesterday I learned that religious leaders, especially in the Christian community, are going to get together and they're going to ask their members to to observe a 1 minute silence tomorrow.
Is that a specific time?
Sorry?
Is there a specific time?
I think it's midday.
Okay.
Midday, yeah.
Wonderful.
So observe a minute silence in remembrance of the first lockdown, the 23rd of March. Yeah. And of course pray.
Yeah. That's really important, I think. Thank you. Yeah.
So let's go on with that.
So coronavirus, the figures, Worldometer, 123,877,740 positive cases globally around the world. Total number of deaths is 2,727,921. And total recovered is 99,799,083.
It's changed.
Oh, is it?
If you want to refresh it.
I do, because I got it up quite early.
Yeah.
So 99,808,514.
And the deaths.
Deaths have also
28 and 64. Yeah.
Yeah.
Okay.
Yeah.
Right.
That's the figure I've got now. Yeah. Thank you.
Yeah. No worries.
Just changes real time. So the top 5 remain the same, with USA number 1 with 30,521,774 positive cases with 555,314 deaths. Brazil number 2 with 11,998,233 positive cases with 294,115 deaths. India number 3 with 11,646,081 positive cases with 160,003 deaths. Russia number 4 with 4,456,869 positive cases with 95,030 deaths. UK 296,583 positive cases, and deaths is 126,155. And South Africa is number 17, so they've moved down to 1,537,852 positive cases with 52,111 deaths. And Ghana, I suppose, would have moved as well, maybe. 89,682 positive cases with 725 deaths. And as we were saying, the 24-hour figure for UK has definitely.
That's very interesting. I want to know that.
I mean, it was really, it's really gone down. So let's see how the rest of the week goes. But as of the last 24 hours, we've had 33 new deaths with 5,312 new cases. And then the day before that, we had 96 new deaths with 5,587 cases. And then the day before that, we had 101 new deaths with 4,802 cases. So that would have taken us up to Thursday, which I think we did Thursday's figure.
Yeah,
But not
there was
Friday.
94 deaths,
Yeah,
wasn't it?
94. Yeah, with 6,303. Yeah. So yeah, so the figures have definitely come down.
Yeah.
And yeah, I think the next steps, the government is looking optimistic, as Boris Johnson has informed us. So, but I think what's happening now with the AstraZeneca, as you said, we don't know what this. We really don't have enough information, but it is going to have an impact on what's going to happen next. So it is going to affect all of us, because I think what I'm hearing as well is it obviously will affect the lockdown. It's going to affect the rollout of the vaccines in other country, and then that is also going to affect the tourism, so even travel. So they're saying that holidays are going to be postponed as well, it seems. I don't know, because
Well,
of this.
from what I'm hearing, the government is assuring us that we're going to be okay. That it's not going to we're not going to have any shortage. That's
Yeah.
assurance.
No, we won't have a shortage, but I think what's going to happen is we are going to see that it's going to affect the impact on travel and holidays, because we don't know what the other countries are going to do about UK coming into their country. So it's, yeah.
I understand now. I know where
Yeah.
you're coming from.
Yeah. So we've actually, it's actually the figure 33 deaths in the last 24 hours is the lowest that we've seen since the death toll seen since October last year. And we've had 844,000 vaccines in the last 24 hours. So, so it's really quite obviously positive news.
I have a very interesting story I want to share with you before you go. We've only got 3 minutes, but let's do this. Donald Trump's main residence, Mar-a-Lago, has been partially closed after some staff members tested positive for COVID-19. The U.S. media is reporting the Florida resort has served as the former president's official residence since he left office in January. The club said in a statement that the beach club and a la carte dining room were closed, but did not specify how many people had tested positive.
So that's like news, yeah. So that's the news. There's an outbreak at the Trump residence. So Mar-a-Lago. So that's, yeah.
Mar-a-Lago, yeah.
So is this where is this where he goes to then? I mean, is this where
that's where he lives now.
He lives.
That's where he lives.
So that's where he lives, his residence. That's what they're saying. Oh my goodness.
Yeah, he owns it.
And he lives there.
It's a beach club, and he owns it. And when he was president, he used to go there all the time, go play golf and hang around there. He's got his residence there. And now he's moved. This is where he lives now.
Wow. So obviously there seems to be some concerns now. But I mean, you remember he had the virus in
he did. His wife
in October.
His son Baron, they all did have it.
They all had it, and some of the officials. So it'll be interesting to see what they're going to do. Because they're saying all the appropriate measures have been taken. So hopefully, we don't know. I mean, he could get reinfected as well. So I think he will probably need to be tested as well. So I think everyone in the premises. But this is a bit concerning, I would say, to know that there's an outbreak. But hopefully we'll hear and see how many. So they haven't really said how many people have tested positive.
Yeah, they said they haven't said how many people got it.
So they're all in quarantine at the moment. So, well, we hope they do get, everyone gets tested, and
wish them well.
We wish them well.
Wish the former president and his family well as well.
Yeah, especially
he doesn't get it again, because it won't be too good if he gets it. For the second time.
But he's so positive every time. So even if he does get it again, he'll be so positive about it.
Yeah, that's what I like about him. He just gets on with life. Anyway, right. Okay, so we're exactly 7:30 now, and
Thank
very
you
much.
so
Dr.
much.
Seshni,
It's
for
been
joining.
amazing.
Yeah,
Just belated
amazing.
birthday wishes to Simi Miraj. I think it was yesterday. There's been so many birthdays. And then today, Parvati Rajmani, so it's her birthday today. So just happy birthday to her and whoever else is celebrating birthdays. It's just been amazing.
Yeah, thank you. Thank you. We'll see you tomorrow, Dr.
See
Seshni.
you bright and early. Thank you so much. Love to everyone. And thank you again for this wonderful mug.
No problems at all. No problems. The least we
Okay.
can do. All right, Dr. Seshni, thank you. And,
Bye. Thanks everyone for joining. That was a hospital radio update. And stay safe wherever you are. Namaste, guys. Lots of love from my family to yours. Bye.